Welcome on behalf of all of the 18 authors of the Manifesto for Healthcare Simulation Practice. My name is Christine Park, and I am the director of the Simulation and Integrated Learning Institute at the University of Illinois College of Medicine. It's my great pleasure to be bringing our group together today. And despite the COVID-19 pandemic, and really because of it, this has been a really rich collaboration, and all of the work was done asynchronously. So this is actually the first time that we as an author group have been together in the same room, so to speak. And many of us have actually not met each other in person. So I'm really excited for this session. As we heard more and more about centers reopening, we learned that there was a wide range of practice in terms of what and how people were making decisions and the language around the decisions that was being disseminated. So this global group of authors, we began this journey with a vision to speak about safety for the simulationist, and to expand our understanding of safety to include that simulation. So safety eventually did become the first tenet of our manifesto, which you're going to hear about in a moment. But we soon realized that we needed to create a framework for a new understanding of healthcare simulation in order to really grasp and understand the entire horizon. And so we have defined healthcare simulation practice as the expert use of established healthcare simulation methodology and techniques. And as with any professional practice, HSP, healthcare simulation practice, requires specialized training, continuous vocational learning, and other elements that you're going to hear about in this webinar. So we're really looking at the entire scope of all the people who contribute their own expertise to healthcare simulation practice. Importantly, we define simulationist as a person who advances the practice through the use of tools, techniques, methodologies, etc. And we come from a great range of backgrounds, a great range of professions and special areas, and we contribute our expertise in many different ways. And so this equitable understanding of simulationists is foundationally important for the understanding of the tenets of this manifesto, which are safety, advocacy, and leadership. So having said that, let's dive right into the tenets, and I'm going to pass the baton to Lou Clark.
Hi everyone, I'm Lou Clark. I'm with M Simulation at the University of Minnesota. And I'm going to share with you about two of the three tenets in this manifesto. The first being safety, as Christine said. And this really hinges on the idea that, we need to think about safe versus less hazardous, because in reality, what most of us are doing right now, if we're back on site, is reducing risk, and we are going for less hazardous, but we cannot truly be safe right now. And I draw on the opening sentence of this section of our manifesto. The safety of patients and learners is a core value for healthcare simulation practice. However, the safety of the simulationists themselves is often overlooked in the understanding of this core value. The safety of simulationists must be embedded in this core value in order to achieve comprehensive safety for healthcare simulation practice. And we think this is just key. It is key that right now is the moment that this is highlighted, and we think it will last beyond this moment, but all too often we are, and it's a good thing, we are prioritizing the safety of our learners, all in the name of patient safety. But right now and moving forward, we need to embrace safety for all of us as a simulation profession. And we also raised the question in this manifesto of who are our essential workers? And the answer is all of us. Whether we're working remotely at home, whether we need to be on site, we are all essential. But we must pay special attention right now to some of the people whose jobs necessitate in many ways that they be on site, and we are thinking about our operations and simulation specialists. We are thinking about schools that have brought back their standardized patients on site. And we're asking and really calling out to folks and saying, when possible, please keep the workers online, because truly that is what will ensure the highest level of safety. Anything else is less hazardous. And to call on my friend Christine, she is very known for talking about PPE as the last stopgap between us and this virus. So it's great that those of us on site, myself included, we are taking every precaution. We are using this PPE, but let us not be fooled that this is the last stopgap. I'm going to go on to our second tenet, and we say this is advocacy, and we explain this as collaboration versus accommodation. So what does this mean, and why is it important? So I'll call on the manifesto again here. Oh. So perhaps in part due to our disparate backgrounds, historical beliefs, or indeed our enthusiasm to champion simulation, healthcare simulation practice has unfortunately often functioned through accommodation more than collaboration. Accommodation reflects how healthcare simulationists work diligently to have others appreciate the already proven value of simulation to provide needed experiences, not otherwise available. So I think to boil it down practically, what does this mean for us? A lot of times we say, yes, we want to accommodate. We want to help people advance their training, and this is a great thing. But right now we need to think about this culture of accommodation we've fostered, because people already know simulation works. It is valuable. Learners benefit from it. We don't need to prove that. So when we accommodate rather than collaborate and advocate for ourselves, we place ourselves at risk. And right now the risks are high. So what we are calling for here is advocacy through partnership, through collaboration. And that can only happen if we voice our needs in the process. And I think that's about two things really. It's about can we and should we proceed with certain events? And I'm specifically talking about on-site events right now. And two, if we decide this is pivotal, we must proceed for whatever reason, let's be a part of how we proceed. Let's advocate for ourselves and say, okay, we're gonna do this, we're gonna proceed, but we need to talk about how this is gonna go. And this can't go, likely in these times, these events can't always go the way they've always gone. And so finally, this section talks about simulation as a rich interdisciplinary profession, and we are poised to lead in these innovative spaces where creativity is a must for continuing to navigate these challenging times. And so I'm going to pass this over to Grace Gephardt to talk to us about how do we do this as leaders.
Thanks, Lou. Good morning and good afternoon and good evening. Our third tenet, leadership, really discusses the need to move to ethical decision-making versus convention. It also makes reference initially to three really important documents that support the whole manifesto and that necessity for deliberate ethical leadership: the Healthcare Simulationist Code of Ethics, the Anaxel Standards of Best Practice, and also the ASPE Standards of Best Practice. The Code of Ethics identifies 6 values that are important to the welfare of all parties in healthcare simulation practice. Within 3 of the values mentioned in the Code of Ethics, integrity, mutual respect, and accountability, we find our manifesto's tenets of safety and advocacy addressed. In the Anaxel Standards of Best Practice, professional integrity and operation is identified. And that again points to our ethical responsibilities as simulationists, regardless of the roles we play. As leaders, we must continuously broaden our perspectives in order to make decisions which further our commitments to safety and advocacy. And the ASPE Standards of Best Practice define and describe 5 domains of practice, which are all rooted in the underlying values of safety, quality, professionalism, accountability, and collaboration. So this tenet, leadership, calls us to action beyond convention. It focuses on the imperative to make ethical decisions as leaders, acknowledging that those very decisions do shape healthcare simulation practice. We must intentionally expand our endurance capacity by thoughtfully engaging in forward planning that protects the entirety of the simulation team. The question of whether or not transposing conventional simulation actions in the plans must be asked as we move forward. Without these purposeful actions of leadership described in this particular tenet, the other tenets of safety and advocacy cannot be sustained in our practice. This is critical for all of us if we're going to take our obligations seriously, to fairly represent the needs of all simulationists, to offer appropriate benefits to all of our stakeholders, and to intentionally foster more innovation and resiliency in healthcare simulation practice, both now and in our continued evolution. Finally, while the COVID-19 pandemic has been a galvanizing opportunity for healthcare simulation practice to evolve and mature, it will not be the only opportunity of self-regulation we are given. We're called to reflect, respond, and mature in our practice at this time. How we as leaders continue to make use of this opportunity, firmly committed to comprehensive safety, collaborative advocacy, and ethical leadership, will better prepare and support healthcare simulation practice to rise up and continue to our work that leads to better healthcare for all.
Thank you, Grace. So that was a quick whirlwind tour through the basic tenets of the manifesto. And now I'm really excited for all the authors who are each going to share some thoughts about what the manifesto has meant to them, or something about each person's own context, or an aha moment, or any other things, personal connection to this manifesto. And we are going to start with Eliana Escudero. So I'll ask you to go ahead and introduce yourself and start.
I am Eliana Escudero from Chile, and thank you very much, Christine, for this opportunity and share with many people in this day celebrating the Sim Weeks, our manifesto. I am working in simulation around 18 years ago. I am nurse, midwives, and master in science in education. I am currently Dean of the Faculty of Health and Dentistry of the Diego Portales University and board member of the Society for Simulation in Healthcare, SSH. I started in simulation in CIRC project from National League for Nursing with Pam Jeffries as the leader and another expert. There, I met wonderful friends, and that was the moment that I decided to dedicate my work to simulation, and since that moment, I am an ambassador of simulation in my country and in region. After I was founder and secretary of the Latin American Association for Clinical Simulation, ALASIC, now FLASIC, I was founder too and president for 2 periods of the Society, Chilean Society for Clinical Simulation and Patient Safety, SOCISIM. I received an international recognition from SSH at MHSc 2015 New Orleans for my development, leadership, and work in clinical simulation in Latin America. So you can see, I love simulation. Do you know that today the world is celebrating Patient Safety Day too? Yes, this is a great coincidence. Simulation Week and Patient Safety Day at the same time. Then I am with the orange color, because the orange color is the color that is symbol of the day, Patient Safety Day. In SSH, I met Christine, and it's been a pleasure work with her because she's always developing amazing projects. So when she invited me to participate in this manifesto and listen the proposal, my thought was, oh, this is great. This is a path to make network, to face a common problem and the new challenges in healthcare education due this new virus. This is the time to join the simulationists, listen to experts, and make good decisions. A learning that I realized from the people who work in simulation is the passion to share their knowledge and their experiences. The manifesto gave me the opportunity to reflect about the needs that my country has for the education-based simulation. Maybe you will not believe that most of the School of Medicine, Nursing, and other health career in Chile never consider use simulation integrating the curriculum until now. There are many educators and students who don't know about simulation at all. So the challenge is big. But curiously, now with the COVID-19, everyone is talking about simulation. This manifesto comes in a good moment for my country and Latin America. We need this recommendation to use simulation with the standards, respect, codes of ethics, and please don't forget the training. Sim center or labs are not environment for game. They are wonderful places to learn and work for human factors, our safety and patient safety too, with advocacy and leadership. Christine gave us permission to speak in our language, so I'm going to speak a few words in Spanish. Invito a celebrar esta semana de la simulación incorporando principios básicos y éticos, seguridad, defensa, liderazgo, compromiso y aplicando los mejores estándares para la reapertura de nuestros centros y desarrollar así nuestro mejor trabajo como educadores en simulación. Thank you very much. Gracias.
Thank you so much, Eliana. And next we'll hear from Keith Littlewood.
Hello, everyone. I'm going to be uncharacteristically concise because my problem is I love all of this, from the process to the product to what it represents. So I can't really choose one thing very well. And there's so many great voices here to talk to us about particular areas. I guess if I really have to think about what is most important to me in the manifesto, forgive me, but I'm actually going to quote a line. We recognize that this manifesto is incomplete. It does not address other pandemic problems, including those of healthcare disparities, human rights, and social justice. So to me, what this represents is a call to action. I'm really looking at that part of the manifesto. But it also represents an important step in the progress and process of who we are. We have the code of ethics. We now have this manifesto. I hope that 10 years from now, these are looked back upon as the beginning of an incredible movement, but just the beginning. So I think we can really rest on the success of what we've done here. It's amazing. It's been an incredible experience for me, and I think all of us. But this is just the start. So let's all get to work. Stay safe, everybody.
Thank you so much, Keith. And next we'll hear from David Lee.
Hello, everyone. I'm David Lee from China. I actually work at the Guangzhou First People's Hospital as a general physician, and also the Secretary General from the Committee for Healthcare Simulation of the WHNP Medical Foundation. Well, actually, everything of this manifesto actually initiated from the COVID. And actually, COVID has like a multiple meaning to me. The first one is that it was first initially reported in China, and actually the place where it is being hit most heavily in China is in Wuhan, which is also my hometown, which I haven't been able to go back to my hometowns ever since the start of COVID. Well, and I would also like to express my appreciation to Christine to allow me to participate in this such wonderful manuscript of the manifesto, because of the meaning of, for me regarding preparing or fighting against COVID. I have been trying my best to use the simulation as a weapon to fight against this. And actually, it shows, at least for me and for many of the Chinese simulationists, it has been very successful, because at least in my institution, our simulation center has started from like a place where all those clinical healthcare workers trying to gather to get prepared before they are leading to Wuhan or other hospitals to do reinforcement, to where like many of the offices, like the Office for Infectious Control, and even some of those who take charge of the logistics, and even the hospital leaderships also come here and or ask us to participate in certain board meetings to come up with strategies to fight against what's to come. And actually, I'm also happy to see that many of the current the government documentations have had the words like the drills or do simulations to get prepared for the first wave, the second wave, the third wave, or the autumn winter wave of the COVID. So I think that has much to do with all those efforts that we do, or what we do as the simulationists to try to do advocacy, and also show certain of the leadership, which is among the two tenets of the manifesto. And I do believe that throughout this process, we have showed the other side of the sexy part for the healthcare simulation to many of the departments or physicians or other workers in hospitals or in other health professions. Thank you.
Thank you so much. And next we will hear from Edgar Herrera.
Thank you. Hello, everybody. My name is Edgar Herrera. I'm from Mexico. I'm the president of the Mexican Society for Simulation in Health Sciences, and also I'm a professor at the Anáhuac University in Mexico City. What the meaning of this manifesto for me, it has been a great opportunity, because it has been amazing to know that the needs that we have in Mexico from all the simulationists are the same that in other parts of the world. And during this pandemic of COVID-19, we have found that we were very scared about what we have to do as a simulationist in our centers, in our hospitals. And this has opened a new opportunity for all of us in Mexico, because of this pandemic thing of COVID, we have found a way to share all this information using video conferences and all these amazing channels that we have right now. And I think that this has been an amazing opportunity, because of this, we are all together right now in this morning in America. And well, what we have worked using this manifesto are to promote these three tenets of the manifesto: the safety, advocacy, and leadership in all of our members in the Mexican society. And we have found that not only in Mexico, but also in other countries in Latin America are very interested in this, because we found right now that we are not alone. We have all the same feelings. We have all the same needs. And this manifesto helped us to show this to our authorities. And in that way, the Mexican Society organized 2 weeks ago a national, but fortunately it was not only a national, but also an international roundtable with directors, deans, administrators, and simulation centers programs from Mexico and Latin America, where we can show all our authorities these needs. We show them that we have a lot of work to do. We need a lot of help, but not only with money, but also helping us to develop these safety and leadership standards for our simulation programs. So this is what we are working in Mexico, and thank you very much for this opportunity.
Thank you very much. And a bit of breaking news. I just heard from Edgar yesterday that the manifesto has been translated into Spanish already. So very excited to hear that. Great. Next we will hear from Jessica Gavilanes.
Hello, everyone. I'm Jessica Gavilanes. I am Operations Director at the Oregon Health and Science University in Portland, Oregon, on the West Coast of the United States. I have a lot on my mind today as we're dealing with natural disasters and really horrible smoke, air quality. So when we think about safety, this is really on the top of my mind. I think that one of the biggest pieces for my team and for our state is that all of our voices matter and that all of our voices are heard. So I think that for me as a leader and in working with other leaders in my industry, on my team, it's really around making sure that people feel empowered and supported to speak their truth and to speak up. So when things do not feel safe, or when there's that kind of crawling question of, is this the right thing to do? We are able to feel supported in a place that we can bring that up. So I talk about with my team around the flattening of the hierarchical curve, because we find that when you talk about this requirement and pressure to say yes, that's not always the right answer for a lot of different reasons. And people want to understand why. So being able to have those very open and collaborative conversations is critical. We're being charged with being creative and innovative, and it is not business as usual. We have been pushed to the brink, and we really do have to be in it together. So for me and my team, I would say that when possible, we are working extremely hard to keep people working remotely. We've been asking people on our team as well, surveying them for what they need, what are their needs to be able to feel safe to come back to work, to be on site. So in some situations within simulation, I've had team members, some of whom are on this call this morning, Lish and Miles and Emma, who have really said, you know, for psychological safety, we really need to consider the temperature checks at our screening, even if that's not happening anymore in other places. If we're going to have SPs come be on site, there are absolute requirements of PPE that must be in place, and there is still the choice to opt in or to stay home. So we're really trying to just continue to create that type of a collaborative environment and really putting safety at the forefront. So I think a lot of people, again, on my team and across the state and the region and the world will know that I often say safety first. And I really believe that to my core. It is a great honor and such important work to be collaborating with such an amazing group from across the world. Thank you.
Thank you so much, Jessica. And next we will travel to India, where we're going to hear from Dinker Pai.
Hi all. So just to introduce myself, I am the director of a medical simulation center in the South Indian town of Pondicherry, which is on the coast, and one of the few places in India which was not occupied by the British, but was occupied by the French instead. And so there is a very to a large extent, there's French culture still pervading the atmosphere here in Pondicherry. I want to take a slightly different perspective based upon my work here in India. As we all know, there are different values in developing and the developed world. If you look at, I'll speak specifically for India. I wouldn't go so far as to use the cliche saying that life is cheap. But the struggle for daily living is so all-pervasive that I suppose the sanctity of human life in on many occasions takes the back seat. And this is compounded by the fatalistic, fatalistic sort of attitude of Indians, which say whatever has to happen will happen. If I'm fated to die, so be it. Which is why I was resonating with David's comment on Kismet a little, in the chat. So all this means that even in the real world, safety on many occasions takes the back seat. And those of you who've been in India and who have had the pleasure of being driven around on Indian roads, I'm sure will agree with me. This also therefore translates into simulation as well. And one of the things, in a way, I suppose in India we are fairly safe as far as simulation is concerned, simply because simulation is not mandated in this country. It is our choice whether we do it or we don't do it. And in most of the centers in India, of course, we have stopped doing simulation, physical contact simulation during the COVID times. But having said that, COVID has become so, inclusive in all our lives that to some extent our senses are now getting dulled, and we are taking COVID as an acceptable part of our life, and therefore we are letting our guard down. I'm sure this is not just true in India, but in many countries, other countries as well. So this is something I feel is happening here, and we really need to be careful about it, because just now, yesterday, in fact, the government of India has given guidelines about restarting professional courses and the practical classes for professional courses. They have given certain guidelines of physical separation, masks, sanitation, etc. But to be very honest, it would be difficult to maintain all these things if we go in for simulation on the ground in the simulation center or in situ. So one of the things that I would like to say is that one of the issues we have is that we do not have simulation staff in most of the places in this country who are exclusively working in the simulation center. Most of them are also clinical staff. And what is happening now is that they are being called upon to do COVID duties, and then they come back to the simulation center. So the risk to us is more from that rather than getting exposed to participants who are coming to the simulation center from the clinical side. So this is one point I wanted to make. And I think I'll just I'll conclude by talking about the aha moment that I found in the initial, maybe, just after 1 or 2 months when when COVID had come into this country. We ran a simulation exercise interdisciplinary with anesthetists and surgeons. And the scenario was essentially a patient of trauma coming in with hypotension and later on developing respiratory distress. And the idea here was for them to think that the respiratory distress could be as a result of COVID infection and not necessarily as a result of trauma. Because the patient it was told to the participants that the patient is coming from one of these containment zones. The anesthetists were right on the ball. Right from the beginning, they were taking all precautions when they were dealing with the patient, etc. But the surgical resident, the senior resident, was somehow, he was careful in the beginning, but the moment it came to trauma and the moment the patient started desaturating, his first thought was tension pneumothorax or something else happening. And it was very interesting to see that he said, I got so involved in the trauma part that I forgot that the patient could also be having COVID, which could be leading to these symptoms. So it sort of drove home the point that, you have to always keep this in the forefront of your thoughts now, and you have to keep it in mind whenever you're dealing with any such patient. And I would just like to conclude by echoing what Keith Littlewood said about looking back 10 years from now. I slightly differ from him in saying that I hope that from 10 years from now, this manifesto that we have created will become totally irrelevant, because advocacy, safety, and leadership will be part, it will be the way of life rather than an exception. Thank you.
Thank you so much, Dinker. And next, we're going to go to the UK for David Grant.
Hi, good afternoon, everyone. My name is David Grant. I've had the privilege in simulation to act in leadership roles, both locally, regionally, nationally, and internationally, and I'm currently the immediate past president of CESA. And I wanted to start, I guess, with my reflections on the manifesto and the times that we've been through, with really touching on the advocacy piece. I'm fortunate to work in an organization where simulation, apart from its educational implications within the organization, has been central to our governance and organizational learning strategies within my healthcare trust. And so what was really, for me, as one of the sort of first group of people involved in trying to establish that, a beautiful thing to see unfold, as I'm sure is true for many of you, that one of the challenges was, from a clinical perspective, to manage the change, because the change came every 24 hours as the government, the healthcare, public health people learned and new guidance came in. And then in my department, reflecting on a sort of micro level with a staff group of over 250 people in PICU or in pediatric ICU, just managing that transition of sort of approach, if you like, within that staff group. And simulation really for our organization was key to be able to, I guess you could call them mini PDSA cycles. So the simulation was definitely used as, it came out in the group sort of, or the healthcare professionals with the assistance of the simulation team would think about how we apply that to practice within our setting. And so, in fact, what was commented on several times is how thankful people were that we had a point of care simulation program that was already had an infrastructure, because it allowed us to seamlessly do that. And so there was a comment made earlier, I must admit shamefully, I did not know that, but that this week, or Patient Safety Day, coincides with Simulation Week. And to me, that's no surprise, because I think simulation has become, at least for our organization, an integral part to that. I wanted to move on to just make some comments around leadership, and I wanted to start those comments by, first of all, just acknowledging, well, so let me start this as a premise. I think amongst the simulation community, I have found some of the most innovative, adaptive, imaginative individuals in the world. And so you can imagine if 18 individuals from all over the world come together to write a document that everybody adheres to or agrees to, is no mean feat. And I just want to acknowledge Christine did a fantastic job harnessing all of our creative thoughts into something that we could finally publish. And so thank you very much to Christine for leading us through that process. And I guess my comment, just to move on from that, is that us, as by definition on this call as leaders in simulation in healthcare, I want to acknowledge that I think COVID, being the sort of catastrophe that it has been, is also a huge opportunity. And so one of the things that I personally, with my role in the university, have struggled, and my interprofessional education work, is how do we distribute simulation, or how do we scale simulation where I can deliver it en masse, and what I deliver is of the quality that I can deliver to a small group of 8 or 12. And I find it fascinating to watch us as a community trying to find that answer. And I think some of the solutions I've seen people bring to the fore in terms of screen-based, what has become effectively screen-based decision-making simulation, is probably not the answer. But as I see people innovate, I'm sure that as a group, we will find the answer that's been inflicted upon us by COVID that eventually will help us to solve that scalability problem. And so I think if there's any group that's going to solve this, is this group. And so it's fantastic to see people starting to grapple with that. And I look forward to the solutions, which certainly I've not found yet and are trying. And that brings me to another point, which is I often feel apprehensive or ashamed even of the fact that I am in my setting in a community of haves. And we talked about in this manifesto about healthcare inequalities, which is a passion of mine. I'm originally from Cape Town in South Africa, for those of you who don't know. And a lot of my work focuses on helping communities like South Africa, Malawi, Sri Lanka, in India, to help reimagine simulation and apply it to their setting. And I think as a community, we will only have an impact, particularly in settings like this, if eventually in the nirvana world, every single healthcare organization that delivers healthcare has the capacity to use simulation to affect safer patient care. And so really that will be my final comment and a call to action to all of us to think about how we serve not just our own institutions, but those around us who are less fortunate than us, to help them harness the power of simulation. Thank you very much, everyone. Thank you for joining us.
Thank you so much, David. Back across the pond to New York for Kellie Bryant.
My name is Kellie Bryant, and I'm the Executive Director of Simulation and Assistant Professor here at Columbia University School of Nursing. So what resonates with me in regards to the manifesto is that as a simulationist, I want us to be respected as essential members of the healthcare team. In addition, leadership needs to know the value of simulation and the work that we do, even when we're not in the midst of a pandemic or crisis. So living in New York City, obviously we were some of the first to deal with the pandemic and the first epicenter in the United States. So many of us were called to task and had to step up during the crisis with very little preparation. And also we were learning as we went along and had to face a lot of change, made some mistakes along the way. And so, some of the things we were asked to do included, donating all our supplies to the hospital, testing out new rapid response protocols for COVID positive patients, to within a few days, developing refresher courses for nurses that were being deployed to other floors, providing education to our nursing students who are now going to be working in the hospital, to actually working in COVID testing centers and participating in convalescent research studies. And most importantly, in an educational system, trying to revamp an entire curriculum to make it virtual in a matter, again, of a few days for over 600 students. So it was a major task. And many of us risked our lives being on the front line and exposed ourselves to the virus ourselves. I'm fortunate. I worked at a facility where it supports simulation and understands the value of it. But I do, as a simulationist, stand collectively with others in the field who were not provided that safe working environment, who are not valued for the work that they do. So my hope with this manifesto and in general is that the work that we do during this pandemic will not go unrecognized, and that leadership, both in the academic setting and the hospital setting, that they will truly understand the value of simulation and support us in the future. Because we know, there's research, we know that simulation is an integral part of promoting patient safety. And we know there's a cost, it's always about money, but I feel that running an effective simulation program is definitely worth the return on investment, and it's invaluable. It reduces reduction in patient mortality, morbidity, reduces medical errors, and we need it to enhance the education of our future healthcare providers. So it's truly important. And I don't want us to forget, we've gone through this and some of us are still going through it, and we're not out of this pandemic yet, but as we start to recover, we need to make sure we don't forget the importance of simulation and continue to use it to educate, promote safety, enhance our healthcare delivery, and again, preparing our healthcare providers. And also it's important that we need to be at the table with leadership, and we need to debrief after this. What are our lessons learned? What worked? What didn't work? What are the improvements we need to make? And also let's not put our guard down. There may be another pandemic. This may not be over. And so we need to be more proactive versus reactive in the ways that we approach this in the future. Thank you.
Thank you so much, Kellie. To Singapore for Sabrina Ko.
Hi everyone, I'm Sabrina Ko from Singapore. Like Christine said, I'm a campus director at Sengkang General Hospital. So we're a hospital training center. And what strikes me about the manifesto is that it came so timely, and I'm very fortunate to be one of them, one of y'all that Christine approached to contribute. So I had a small experience to share, because this really struck me as in terms of leadership. So we will actually push to provide more training in times of COVID, not just being sent home and work from home, but in a hospital base, we actually reallocate manpowers to provide services for the front line, such as the emergency room or the intensive care unit. So with that, we ended up having to cross-train many people from the OR, because they no longer take elective cases, and other places such as outpatient clinics. So with this training, people were asking for us to provide in situ trainings. They were really too busy to even get down to the center, even when we are within the same building. So that's kind of a tight situation that we were in. So, but what happened to the staff members in the SIM center is that, well, typically to the hospital is that we draw our PPEs within the department. That's based on head count, because that's the allocation due to scarce resources. But these PPE weren't coming to the SIM center. So as our folks needs to provide that service for in-situ training, but we didn't have sufficient PPE to be there to provide the service. So this manifesto is really very, it resonates my sentiments. And along with all of you, I cannot be in your shoes totally, but at least half of your shoes. And I want to echo about safety for our staff members. So there was a situation that I have to pick it up and walk to the materials management department and explain to them that safety is for everyone. It's not just the front line. And I needed them to trust me to manage the resources, that we are not hogging, but we are definitely using what is necessary for the safety of our staff. So this is a personal experience that I have, and I'm very glad that I'm part of this manifesto, and I believe this is for everyone. And the manifesto is not just for simulationists, it is for the entire healthcare system. Thank you.
Thank you so much, Sabrina. And now we're gonna go to Boston for Jamie Robertson.
I'm Jamie Robertson. I am the Director of Innovation in Surgical Education at Brigham and Women's Hospital and Harvard Medical School. And I was very lucky to be brought in on this project. I think it really speaks to a lot of the things that I was thinking about pre-COVID in our simulation, but that the pandemic has really pushed forward even more. And the part that I think most spoke to me was this idea about collaboration versus accommodation. As somebody who loves simulation and thinks that it is an amazing way for us to work with our learners, for us to teach, and for us to improve patient safety, I want everyone else that I come in contact with in our healthcare system to think the same way that I do. And often that leads to being pressured to do things that I don't think are the right way to do them, that are not necessarily in line with best practices, that as a simulationist and as an educator who has really devoted my life to this, I know those things, but people who have little exposure to simulation, have had no formal training, no education on the topic, haven't spent any time with it, shouldn't be expected to know. And so I think really just to read a very short passage from the manifesto, we said that in this context, accommodation reflects how healthcare simulationists work diligently to have others appreciate the already proven value of simulation to provide needed experiences not otherwise readily available or ill-suited to explore ad hoc environments. We often accommodate requests by reacting with yes first and with the intent to determine implementation later, educate potential stakeholders, and transform them into champions. And that really reflects to me a lot of what my life has been as an educator and as a simulationist, is that say yes first, and then just figure out how we can make it work within what the person wants later. And so really drawing out this expertise that we as simulationists and we as the simulation community have about how the equipment should be used, how the space should be used, what are the things that need to be in place to run a high quality education session that is safe for the participants, that is safe for the the standardized patients that might be there, that is safe for the simulationists who are working on it and is safe for the instructors. And I think being involved in this has really allowed me to push back this year when we've reopened stuff and had the possibility of running our OR team training programs live and in person, to say no and to really try to protect the safety of myself as somebody who's working from home and would have to come in specifically for that, of our simulation staff, and also of our participants who do not need that further exposure to each other in close settings where they're going to be doing CPR or operating on a mannequin, to instead keep them in safe places, keep them home, and figure out how we can serve the same needs while keeping people as safe as possible when they are not providing clinical care to patients. So thank you very much.
Thank you so much, Jamie. And over to Little Rock, Grace Gephardt.
This has been delightful for me. I think that one of the things that I'm left with as we get closer to finishing our webinar is really the brightness and possibility that I hear and see and can feel from across the globe. And it's really quite inspiring. You know, there's an English phrase, rising tide lifts all ships. And I feel like I'm having that experience with you all. I can say that one of the things I most appreciate, and there are plenty of them, but one of the things I most appreciate about having been involved in this, in the process of birthing this manifesto from almost the very beginning, is that as we spent time having lots of conversations as we were writing and starting over, and you know how that goes, it occurred to me very strongly that I had an opportunity in my own program to really practice and try some of this on in ways that I might not have felt empowered to do had I not been at the table in these conversations as soon as I was. And so it has been satisfying, perhaps is not the right word, but it has been satisfying to stand my ground in a kind but firm way on behalf of my program throughout this whole process in the pandemic with the leaders in my organization. And to their credit, I have never been pushed back against saying anything, you know, nobody has ever said that's ridiculous or come on, grow up, or you're being, there's never been a derogatory comment. And I recognize that that perhaps is an unusual experience as well. So I'm appreciative for that. I also know that Christine has responded, but I sure do think that Elizabeth's question that she posed in the chat is very interesting and might really bear fruit in terms of continuing to help this tide rise for us as a practice of committed folks. And I just would end with that.
Thank you so much, Grace. And to Twin Cities, Lou Clark.
I just want to echo what Grace said. What a pleasure. And this is my first time meeting many of our global co-authors. So I have loved hearing your thoughts and learned so much. So thank you for that. I'm left with just thinking about what Grace said. This manifesto, I think it's safe to say, began in the late spring. It began through conversation with Christine and Grace and I about deep, deep concern for colleagues, friends in our profession that did not have the same support that Grace just mentioned. I have it too at Minnesota. I have tremendous support from our leadership. I was able to put a safety plan in place, informed and co-authored by our team members. And I think that's important to say, that every single member of our team had a voice in constructing the safety plan that we put in place on May 28th, our flexible operations plan, and we are still using today. We amend it, we do it as a team. They have to be involved, everybody on site and online. You know, we think about physical, but also psychological safety. Every single team member is part of that plan, and it's a living document. So I think about that. And that's really important to me, because before I had the privilege of being in this role, I started off years ago as Lou the SP trainer. And Lou the SP trainer has informed every step of this process, because anytime, and before that I was a theater artist, so I'll share, you know, my arts background. Why is that significant here? Because anytime we have a profession that requires us to use the capacity of our body, to put our body on the line and be involved in whatever way that is, we need to think about caring for the body, the mind, the psyche, everything that goes with that. And that informs my work every day with this team that I'm so proud of. And really the work that I'm proud to be a part of in this profession globally. So that's what I'm thinking about here at the end. I'm very inspired by all of you, and I remind us that to please, everyone here, be in touch with your people, communicate. We all have to do this together.
Thanks so much, Lou. I also need to give thanks to a number of people who have been acknowledged as part of this work, who were authors in the Code of Ethics Working Group. And it's incredible to think that when the Code of Ethics was written, when the standards of practice were written for NEXL and ASPE, I'm quite sure that none of us could have imagined that we would be leaning on those standards in quite the same way that we are today. But we still have a lot of work to do. Grace mentioned a rising tide lifts all boats, and that only works if all the people are in the boats. And so everybody needs to be in the boat. I want to call out that we say at the end of the manifesto that this manifesto is complete, and that's very much true. We didn't, for the scope of this manuscript, dive into all of the other major problems there are in the world around human rights and social justice. We are in a lot of pain here in this country, in the United States, and that pain is around the world as well in different ways. So I'm hoping that there will be future work, future manifestos that come out of it that directly address those things. I do know in our own larger staff community that they do have expressed that they are at the receiving end of a negative power dynamic that we have learned about and that we also have only just begun to explore.
Hello, my name is Dana Downing, and I'm with the simulation program at Children's Health in Dallas, Texas. The part of the manifesto that really resonated with me was advocacy, collaboration versus accommodation. You see, I see accommodation as impacting the ability to lead and to keep our simulation professionals safe. And much like the manifesto describes, in my organization, we've been conditioned to say yes and then figure out how we will put the education and training in place. In other words, very often, or too often, we have to accommodate. And with a full-time staff of just 2 educators, I wonder whether or not what we're doing is sustainable, and what's the impact going to be on the quality of our simulation events as we're putting more strain upon our resources. As a simulation professional, I should be able to call upon the collaborative relationships that value our expertise and our opinions. But what I bump up against instead are the same types of relationships that will prompt us to say yes when we should be putting on the brakes. Over the last several months, COVID-19 has really shed a light on this within the simulation community, in particular with the implementation of in-person simulations, regardless of potential impacts on health. And we can do whatever we want to try to mitigate the risks, whether it be face masks, cleaning, social distancing, but that's all we're really doing is mitigating risk. We're not making a truly safe environment for the simulation staff. And in my case, we're even exposing our simulation staff to others for longer than we normally would. For instance, a 4-hour course now will take us at least 8 hours to run. And that means that my staff is then being exposed to the same facilitation group for an entire day instead of just 4 hours. Now, we do what we can to reduce the risk, but we should also be able to say no if we deem a practice too risky. As the Simulation Manifesto says, our ability to work together in collective advocacy is important, because during this pandemic, we must remember the health of all of our simulation professionals. We uphold the safety of patients and learners, but we seem to not give as much attention to our own profession. As leaders in simulation, it is our ethical duty to maximize safety, eliminate unnecessary harm, and to create a safe work environment. And as long as we're unable to form relationships based on collaborative mutual trust, and we continue to feel obligated to say yes, we will struggle to implement comprehensive practices needed to keep all parties safe. This needs to change. Thank you.
Hello, my name is Michelle Kellie and I work at Curtin University in Perth, Western Australia. It was an absolute pleasure to be invited to contribute to the Manifesto of Healthcare Simulation, led by Dr. Christine Park, with a stellar cast of global authors who practice, lead and research in the field. As a relatively young community of practice, healthcare simulation is maturing at a rapid rate. And since COVID, healthcare simulationists have taken on the challenges of innovating and adapting delivery of programs in service and educational sectors. A plethora of publications in this space is evident of the huge impact of this pandemic on service and education domains in simulation. So it is timely that Christine Park saw the acute need of clarifying the place of healthcare sim through the vehicle of a manifesto to deliver a clear message to others, what many within the field have embraced for decades. The three tenets of safety, advocacy, and leadership represent elements that have been fundamental to our community of practice. In articulating the what and absolutes of healthcare simulation practice, this manifesto is important in many ways: to underpin and complement business cases, for robust structures and processes in the field, to highlight the unique skills that simulationists and teams embody, and as a roadmap for development in countries who are in the earlier stages of embracing healthcare sim and embarking on their journey. I'm certain this important publication will become a seminal piece of work in our field.
Hello, everyone. I'm Jane Lindsay Miller, and I direct medical education research at the University of Iowa's Carver College of Medicine, and have spent most of the past 20 years as a simulation professional and leader, both here and at the University of Minnesota. I wanted to share a few thoughts about why writing the manifesto was so important to me. Like so many of you, I've been privileged to see the transformations that simulation can create, whether we're teaching interprofessional practice in the OR or the birthing suite, or communication or physical exam skills in the clinic. But I've also seen how vital simulations can be for the betterment of our society. Right now, here in Iowa, I'm using online simulations to bring together healthcare interpreters, medical students, and residents to understand better how they can serve the needs of our non-English speaking residents through telemedicine and remote video interpreting. One of the faculty members in the Masters of Medical Education program that I oversee has been a real innovator in creating protocols for teaching intubation of COVID-19 pediatric patients using safe simulation practices. I believe it is our responsibility, even our obligation, to use these powerful tools to explore the causes and solutions for health disparities. As we face the challenges of a global pandemic, a fractured and fraying healthcare infrastructure, and unsustainable educational costs, we have to start reevaluating the role of simulation in healthcare education and training. We must ensure equitable access to simulation resources, equal value to different specialties and professions, and safe and effective practice, both in person and online. To me, the manifesto means the start of a critical conversation about a maturing and still misunderstood field. Simulation as a practice is enormously rewarding. we now find ourselves at a point where it can even be disruptive to our assumptions about what medical education can and should look like. Effective simulation in the age of COVID is challenging our assumptions about how experiential education can be delivered and how we can use video conferencing technologies to expand our outreach and democratize simulation on a global scale. Thank you for giving me the opportunity to share a few minutes with you, and I hope you find the manifesto educational, inspiring, challenging, and even provocative. Best wishes from Iowa.
Hello, my name is Deborah Nestel. I live and work in Australia, and I have a split appointment between Monash and University and the University of Melbourne, and I'm editor-in-chief of BMJ Stell, which is the journal in which the manifesto has been published. I'd like to congratulate Christine Park for her leadership in bringing together authors from, I think it's about 18 different countries to create the manifesto. You will be familiar now with the tenets of safety, advocacy, and leadership. And I think these are actually, there are many points of intersection. And I just want to spend the next 2 minutes talking with you about a couple of things that have occurred for me during the pandemic that's helping me to address these tenets. And like I say, I think that they really are intersecting. So the first thing is the pandemic has enabled me to have conversations with people that I don't often get the time to actually pause and speak with. So that's been a really good thing. Words matter, and words are our culture. They describe our practice, and therefore we have an opportunity to influence our culture by choosing words that are respectful and meaningful and actually reflect the true nature of what we do. The notion of standardized patient has been troublesome for me for some time, but the pandemic has actually brought it to the fore. I've had the opportunity to have conversations again with a range of individuals, and when I shared this notion of a standardized patient with a patient liaison officer, someone who's a patient advocate, she was absolutely mortified that we would choose the word standardized to be an adjective for a patient. And it has got me thinking again, why do we do that? Her response was, it's so dehumanizing. You might as well just call me by my disease. And that's pretty confronting. So also important to know that in Canada and the US, the phrase standardized patient is commonly used, but much less common in the rest of the world. I mean, it is used, but much less common. And certainly the heavy assessment tradition, I can understand why the word might have been used, but certainly when I think about simulated patients contributing to high stakes assessment, I refer to their practice as simulated patients who can standardize their portrayal for the purpose of assessment. I just think that, so in summary, dehumanizing, it takes away from the notion of being an individual, being person-centered. And I guess relative to the tenets, this is about challenging convention. And I also think there are safety implications here. What are we conveying to our learners by referring to patients as standardized? The second phrase that is troublesome as well is non-technical skills. Firstly, by calling something by what it's not, a deficit model, I think we're asking for trouble. It's so complex. There's the range of skills that included in that kind of cluster of non-technical skills are really diverse. And I think that we've got to find better descriptors. You know, even communication is a highly technical skill. It's highly technical. So to even call it non-technical it's misleading, it's inappropriate. So I think we have to get better at calling things by what they are rather than by what they're not. And again, what messages are we conveying to our learners by referring to them as non-technical? and range of references there that have sown the seed of these ideas. The last thing that I want to refer to is diversity and inclusion, and particularly for me with my editor-in-chief role of healthcare simulation scholarship. If you have a journal with an international mission for health and social care professionals and their practice, then I think you need to have an editorial board or at least advisory groups that represent that diversity and inclusion. So there's some of my missions for the short term that have really surfaced in the pandemic, and I'm well, very grateful that I'm able to share them with you in this recording. Again, thank you, Christine, for your leadership in the Healthcare Simulation Manifesto.
My name is Jan-Joos Gert-Hans, Professor of Human Simulation at the Skills Lab of Maastricht Medical School in the Netherlands. My main focus in simulation has always been working with simulated patients in undergraduate medical education. I've seen how much variation there is in management of simulated patient centers between institutes, but even more between different countries. This manifesto once again opened my eyes how imperative it is to have standards of practice in this wide field of simulation, as for example has been published by the Association of Simulated and Standardized Patient Educators. Indeed, more than ever, now this calls for safe practices for all involved in simulation, no matter at what level you are working. This manifesto encouraged us again to strive at the Skills Lab in Maastricht to establish a safe teaching environment for our students, for our simulated patients, and for all our staff in a collaborative way. I'm proud to say it works, and I'm sure that you in your specific setting can make this work too. Thank you very much.
So just want to thank everybody again for joining us from all over the world, whether it's morning, afternoon, or nighttime. For you, and thanks again to all of the authors and everybody for sharing such incredible thoughts today.